Good morning. Thank you all for attending this very important public press briefing today. As Minister of Health, my first priority is to assure the people of the Cayman Islands that the Ministry and the Public Health Department, along with all relevant stakeholders, have been working tirelessly to ensure your safety. Rest assured, we are ready to deal with this virus should it arrive on our shores. The first reported death outside China was reported over the weekend in the Republic of the Philippines. 63% of all cases since the start of the outbreak have been reported from the Hubei province in China, and there are now 14,557 confirmed cases worldwide, with 23 countries other than China reporting cases. The World Health Organization has given the risk as high at the global level, and there have been over 300 deaths. I gave an address to the House on Friday earlier on this matter, and I want to reiterate now that there is an action plan in place which all parties are executing as needed. The public can be reminded that all this time, all registered practitioners have been provided with information on this public health threat through the Department of Health and Regulatory Services. The Department of Public Health held a multi-sectoral meeting on Wednesday, the 29th of January, and amongst the attendees were senior members of Custom and Border Control, the Port Authority, the Airports Authority, the Ministry of Tourism, and staff from across the Health Services Authority. Plans for managing arriving passengers and people who may be at risk from the novel coronavirus were discussed in detail. Additionally, plans for transferring and managing patients who require hospital care were also discussed. The Public Health Department is having an ongoing communication with Cayman Airways, offering support and advice. The Department of Public Health is also officials have been in contact with the cruise ship industry and have been informed that the cruise ships are conducting screening on all joining passengers and are denying boarding to joining passengers from mainland China until they have passed a 14-day period since leaving. It is also reassuring to know that travelers who are coming from China are being screened on arrival in Canada, the UK, and beyond. Highly visible information from arriving passengers will be placed at ports within days. The Customs and Border Patrol officers are already screening all arriving passengers for travel histories to China, who will be notified to the Public Health Department. Public Health will monitor any at-risk individuals for the incubation period and support their healthcare needs as necessary. A number of major airlines have suspended flights from the mainland China. Australia, the Bahamas, Jamaica, Japan, Mongolia, Singapore, Trinidad, the USA, and Vietnam have sought protection through denying entry to travelers from China until they have passed a 2-week incubation period, even though any restrictions on travel are not recommended by WHO, World Health Organization. Despite all this work, we have to count on the community to do their part as well. What we know so far is that transmission from people with no symptoms is not likely to be a major form of transmission. Persons who have symptoms will spread the virus more readily through coughing and sneezing. Therefore, the public is reminded to be in the know about the 2019 novel coronavirus. The virus is one of the family of coronaviruses, which include one causing the common cold. However, this particular strain has not been characterized before. Whether you are traveling or not, the public is advised to practice general infection control measures, such as frequent hand cleansing with soap and water or an alcohol-based hand sanitizer, covering nose and mouth when coughing and sneezing, avoiding close contact with people suffering from acute respiratory infection. Masks are also being placed at entrances of clinics across the island for people with respiratory symptoms to use so they can reduce the chance of any spread of the infection to others when they are in the clinic. Also want to note that there's no reported cases in the Caribbean or the Cayman Islands. Also, I recommend that all Caribbean or Caymanian citizens should postpone their travel to China until the all clear is given, whether it's for vacation, business travel, or conferences. In conclusion, I would like to encourage everyone to do their homework, as there may have been myths and misconceptions spreading around on social media and on WhatsApp. Our medical experts today on the panel can discuss more with you, each of you, about these, and I know the Public Health Department will be disseminating myth-busting information as a part of their communications agenda starting tomorrow. Please stay safe, everyone, and God bless the Cayman Islands.
I'd like to thank the Minister for the presentation, and he has given us a lot of information, which we are sharing as much as possible, because the most important issue with regards to coronavirus potential for causing harm, both here and abroad, is that the public should be informed. So we're doing everything that we can to push out information by all sorts of different channels, whether they be in the form of pamphlets or newspaper releases, or through radio, or through the press, and through the internet sources. I am confident that the Cayman is ready to tackle any threats that come to our shores in this regard. Dr. Williams will probably talk more about that readiness. Clearly, this disease is of significant international concern. The death rate rose by over 50 overnight in the new reports. The mortality rate is at 2%. What I think we can take some reassurance in is that both the mortality rate, which is the ability for the coronavirus to cause harm, severe harm, as well as its infectivity, is low compared to some of the other pandemics that we have suffered. Unfortunately, pandemics are becoming an increasing issue since in this century we have had more already in the last 20 years than we have had in many, many centuries before that. One issue that concerns me with the novel coronavirus is that there is quite a high incidence of severe illness, in that it's around 15%. I would encourage everyone to educate themselves as well as they can with regards to the virus, and reiterate the need to maintain good hygiene, wash your hands with soap and water, to use hand sanitizer, to use cough etiquette when you're coughing or sneezing, to cover your nose and mouth, and to dispose of a disposable handkerchief, and to keep a good distance from people with acute respiratory infections. If you are traveling, stay clear from wild animals and farm animals. That currently is not a recommendation that is needed in Cayman. But I'd also like to take this opportunity to thank very much the staff of the Public Health Department and the staff more widely, who I know have been working tirelessly since this event, and particularly over the weekend, without any rest, in order to try and get information out to you and make sure we're adequately prepared. Thank you.
Thanks, Dr. Lee. Thank you all again for being here in this press conference. It's very important that we keep the public aware. I know that the Minister and Dr. Lee already have provided some data. I have some point here that I want to highlight. I don't want to miss anything that we have been doing, not only the Public Health Department, but all different agencies that have been put together in order for us to tackle this outbreak. The statistic, the numbers keep changing, and every day, every hour, basically, we have an increased number of confirmed cases, and also the number of dead, and the number of countries that have been affected. It's up to 25 countries now worldwide. In our region, in the Americas, we have cases in the USA and in Canada. We have 11 confirmed cases in the USA and 4 cases in Canada. The cases in the USA are 6 cases in California, 1 in Arizona, 1 in Washington, 2 in Chicago, Illinois, and 1 in Boston. It's important for the public to know that this is a new virus, it's a new coronavirus. Coronavirus as a family have been around for many years. and it is a cause of 15 to 25% of regular respiratory infection. However, this new virus is the one that is causing the outbreak that started in China in December and now has spread all around the world. There's a lot of unknowns about this virus. We know that it can be transmitted from animal to person to person as well, for the data that we have been receiving. As the minister has said, there's still not enough data to support that person without symptoms can spread the disease, and even if they can, the probability of getting infected by someone without symptoms are a lot less than when somebody actually who has symptoms. I also want to highlight that we have been in constant communication with international organizations, with the Pan American Health Organization, with the Caribbean Public Health Agency, and also with Public Health England. And we have been receiving data from them, guidance as well, and on the way forward. As the minister has mentioned, all the physicians in the public and the private sector have been informed through the health regulatory services of the case definition, case management, and lab capacity here in the Cayman Island. I just want to highlight that as of today, the 3rd of February, there are no reported cases of coronavirus here in the Cayman Island, and that's very important for everyone and for the public to know. We will continue to update the public on a regular basis. The website at the Health Service Authority will be updated on a daily basis with information about the coronavirus, so we invite you to visit the HSA website, where you will get a lot of new information about the virus. Also, we've been doing press releases. We will be doing a lot of radio interviews during this week. Different stakeholder, the CMO, Custom, myself, will be attending this radio interview. Also, the HSA is planning to implement a flu clinic. This was implemented before in 2009 when the outbreak of the influenza, and basically to attend any patient that will have flu-like symptoms. What we're trying to do with that is kind of separate patients that could be a potential a risk of this disease from the rest of the other patients that may be attending the clinic for a different reason, and we'll be talking more about this in the next hours or so. We have prepared also radios, PSAs that we have been sending. Actually started this morning already in DMS broadcasting, and this afternoon will be in Harley's Media and Radio Cayman. We have posted a lot of information on social media through Facebook and other social media avenues. It already has reached over 10,000 people have been advised. So we will continue to work. Also, there is we have prepared frequently asked question document that will come up tomorrow in the Cayman Compass, as well as already in social media for you guys for the public to be aware of what we're doing. When it comes to surveillance, though, we normally have a year-round surveillance for any communicable disease. Of course, that now has been enhanced, and we are in very, very close communication with the port of entries, with at the airport and also at the port, for any patient that come with symptoms suggestive of this illness or flu-like symptom, and especially with a travel history, any travel to any of the countries that have been affected by this disease, especially from China, and then we're taking measures with this patient. We have measures in place to send one of our officer, a public health officer or public health nurse to the port when needed, interview the patient, and then take information on the information, give advice. At this point, we are actually quarantining this patient if they are to come here, and if they have symptoms, we have mechanisms in place to transport the patient to the hospital, and the hospital have isolation rooms available to manage this patient. They need to be managed there, and to admit them the hospital do have an intensive care unit which is able to treat a patient with this or any medical condition. So I think that's it for me now. I will be able to answer questions after.
Good morning. I'm just here to assure the public that the officers of Customs and Border Control are being very vigilant in ensuring that they check all arriving passengers their ports of entry. They're going through their documents to ensure that they have not visited China within the last few weeks, and we are being extremely vigilant with this matter. We have partnered with HSA, as you've heard before, and we have sent information to them in relation to persons who have arrived, who have shown symptoms of being sick, and HSA has dealt with the matter accordingly by monitoring and doing what they need to do. We have taken the step of providing our staff with a kit to ensure their safety also, as they are the first point of contact when people come off the ships and the aircraft. So we just need the public to be assured that we are doing our part as the border control officers to ensure that we keep this coronavirus away from our shores.
Ladies and gentlemen, any questions?
Thank you. Good morning. Reshma Raghunath, Cayman Compass. First of all, I'd like to know, the minister mentioned monitoring and I think Dr. Williams, you did as well. What does this monitoring process entail when we have passengers coming in? Is it a form they fill out? And after that, what kind of follow-up do you have planned for that?
Yes, thanks for your question. So once we have been alerted by the Custom and Immigration that we have a passenger traveling from one of these areas that have been affected with or without symptoms, we will send one of our public health officers to the airport. We do have a public health office or room at the airport where we can take the patient there and interview the patient. We will take information on the patient relevant of where they travel, where they're coming from, also any symptoms at all, how long they left China, if we're looking at China specifically, where they're staying here, and all of that information we'll keep it in our records. Also, we'll advise the patient that they need to be, if the patient has no symptoms at all, that they need to be quarantined at home, and we will follow up on it regular by phone calls, and by visiting to the house to make sure that the patient, one, is staying at home, and secondly, if they have any needs, we can assist them as well.
If I could maybe add to that, please. I just wanted to reiterate the fact that what we are trying to do is to allow people to bring themselves forward. Because certainly, even though you institute screening, even though you provide people with information, you may miss people that have come into the country who may potentially be at risk. There is a scenario where somebody who has not been to China may have met somebody in an airport, for example. So the most important thing we want to do is to make sure that every traveler is aware of the potential symptoms, and that if they've been traveling, they need to come forward and report themselves to their local healthcare practitioner. If they are going to present and they feel they may be in an at-risk group, they need to call ahead, let the healthcare practitioner know they're coming. When they attend, many of the clinics have got masks outside, but if you wait in the car, wait outside, that person will be taken in and questioned accordingly. But we would like to encourage people to bring themselves forward should they believe they're at risk, rather than it to be seen as in any punitive way, which is why we're going to be putting a lot of information, a lot of emphasis on information at the ports, so that people get a lot of visual clues and pointers as they enter the country.
So
Sorry, one more thing. Mr. Wong may wish to add, but we will be preparing cards so that anybody, especially people who don't know the islands well, will have a card placed in their passport, so they will understand the steps they can take to help themselves to access help if they need to.
Okay, so how will Customs and Immigration know who's coming from China? Do you have a specific form that has been created for this, like we had in the Ebola situation?
No, we don't have a specific form. Officers are being very vigilant by checking people's travel documents. It's possible someone might not want us to know that they're coming from China and tell the officers no. So they do check their documents along with the question, and they could lie, but the documents wouldn't lie.
I just want to add to that those alert cards that we're gonna be giving to every single passenger by the Custom and Immigration Officer will be in both English and Spanish, and also the card is mainly giving the person tips of what to do or where to call, who to approach if they develop any symptoms, rather than going straight with a question, have you traveled to China or not, because we may get somebody who actually had traveled to say no, even though the immigration officer had the capacity to confirm that with the. But we want to encourage people to still come to the Cayman Island. We want to make sure that they know we are prepared and that we give them all the information that they need in case that they develop any symptoms, where to go, who to call, and what to do.
In this process, there has been a lot of racial profiling, looking out for Asian individuals, people of Asian descent. These cases are not just limited to China now. We have cases in the US and Canada and in Europe. Are you looking with the same diligence to other passengers who are coming who may not look Asian?
Well, that's a very good question, and I just want to say that the CMO and myself just came off an emergency novel coronavirus video conference with all the health ministers in the Caribbean, and as we look at it, and as we heard the numbers from the different countries that are being affected, I would humbly suggest that we continue to monitor those countries. If cases are elevated in countries, that we also need to look at not only just Chinese travel, but if someone traveled to the Philippines or otherwise. We had the first case death in outside China and the Philippines, so that may be something that we need to do. But the Security Council will be meeting tomorrow, and we will get further directions from the Security Council as to what measures we take. Obviously, CMO and the Ministry of Health have some concerns, and we want to move quickly in our announcement about what this country is doing. And but we await the meeting of the Security Council tomorrow before we finalize what this country will do.
Yeah, I just want to add to what the minister just said, and to answer your question. This is a very fluid situation. It keeps changing all the time. Yes. Right now, over 95% of the cases that have local transmission have been only in China, and that's why right now we're looking at not a Chinese citizen, but people who have traveled to China right now. But of course, if the disease continues to spread and we have more local transmission in other countries, we'll definitely have to add other countries at that list that we are surveying or screening right now.
Okay. Now, you mentioned a flu clinic has been set up at HSA and masks are being distributed for patients coming in. But how effective are these masks, and which masks do you recommend the public to use to guard against? Well,
the flu clinic is about to start. Has not started yet, but we're planning to start it in this week. When it comes to the mask, first, we don't advise our general public to wear any mask. So it's just the measure that Dr. Lee and the minister have mentioned about hand hygiene and cough etiquette are really, really important right now. But the regular mask that we will use in a clinical setting, it will be the regular surgical mask. There are more specialized type of masks called N95, but that mask is only recommended for healthcare providers where they are providing procedure to the patient that can develop aerosol, like intubation to a patient and things like that. But for now, in a healthcare setting, just a regular surgical mask or medical mask will provide protection.
Okay. I'll pass off to someone else, but I want to ask this quickly before I forget. Minister Seymour, has government set aside any budgetary allocations to specifically deal with the coronavirus response?
We had a meeting on Friday, emergency meeting called by Premier at the LA with the CMO, the CEO for the HSA. And there was about 10 persons in this meeting. The Chief Officer for Border Control, CAP Secretary, Mr. Mervyn Conley, from the regulatory side, and Chief Officer, Nelly Pucci. And from that meeting, well, there's a lot of things that we recognize in terms of readiness here in the Cayman Islands. But we have to constantly monitor what's going on internationally, so that we can be prepared here in the Cayman Islands.
But no specific money has been allocated
yes,
just yet.
That meeting was about the money.
Mm-hmm.
There's a paper coming tomorrow to Cabinet.
Mm-hmm.
It's about $1 million. That's being asked for right now, and that is to prepare a room for persons if anyone gets infected. That would include buying additional equipment and so forth. The room has been identified at the HSA. So the Premier has said, whatever it takes, we will vote the funds to ensure that this happens.
Anybody else?
It's actually over $1 million. It's the estimate.
No more questions from the media?
Sorry, thank you. Dr. Williams, you talked about quarantine. What's the setup going to be at the HSA? Can you describe is there a specific area that's going to be prepared? Is it going to be in the main hospital? What's that plan looking like?
Well, the quarantine that we have, we're planning to implement now that is in place won't be at the HSA right now. The HSA will manage the cases that need medical attention. As the minister just said, there are being a proposal. There's an area identified to manage this patient. When it go over the number of patients that we can actually manage on a regular basis at the HSA, the quarantine now we will suggest to be at home. Mainly for residents or people who live here. For visitors now, we'll have to sit with government to identify a location where this person can stay, be quarantined on, and then of course the HSA and the public health department will follow up on this patient. But definitely the quarantine won't be at the HSA. At least that's not the plan for now.
If I could just add to that point and develop it a little. The issue of quarantine is a legal one. Under the public health law, there are certain processes that would need to be followed. So if we were to, if at the National Security Council any decision was to be made in this regard, that would be, it would be for Cabinet to designate whether people would be quarantined and under what circumstances in the category. So we need to develop, there are a lot of plans that different agencies such as CARFA have advised upon, but the National Security Council, I'm guessing, Minister, would need to decide about whether or not they wish to implement that. At the moment, we are advising, Public Health Department is advising any potential people and giving them advice to stay at home and to limit their contacts. And so that is the current scenario.
And that's advice for those coming into the island. The virus has shown a 14-day incubation period. What about people who may already be on island? I'm not trying to scaremonger or anything like that. That's definitely not what I want to do. But for people who have already arrived on island, residents, what would you recommend they do?
So anybody we've identified as being in that category, we have contacted and advised as such. But if there are people that aren't, we would advise them to please let public health know or their local healthcare practitioner know of their status. And public health will reach them and advise them. But that advice would be to limit their contacts and to stay at home.
I understand what you're saying, because there may be persons on the island that that have some symptoms, and because they're hearing that the quarantine will be for 2 weeks, may not want to be quarantined. We're saying to them that we're talking about a country here, the whole country can be affected by making that kind of decision, and it would be best to come in and get treated as soon as possible. We don't need any fatalities here in the Cayman Islands.
I think I need to add for the public that we are in the midst of the flu season anyhow.
Yeah.
So a lot of people will be experiencing flu-like symptoms this time of the year. So that's why, and we have no cases here in the Cayman Islands, so that's why the travel history is so important now. If you develop flu-like symptoms, but you have not traveled to any of these areas, or you have not been in contact with anyone who has traveled to any of these areas, it's very unlikely that you have the coronavirus. It's more likely that you had the regular flu by influenza or any other virus that caused the flu. It's important for the public to know that, and they can contact the healthcare provider, or they can contact the public health department. We'll be more than happy to discuss with them and advise them accordingly.
Members of the media, if there are no remaining questions, then let's bring this press. Chris?
Well, yeah, I'm still not all that clear, and I think it's important, you know, are you saying that if people haven't travelled anywhere and they've got flu symptoms, not to worry about it, or to come forward anyway? Or what about people who have travelled within the last couple of weeks and have got flu symptoms? Can you just clarify it, because I think it's important, and I might have missed something, but I'm not all that clear about what the take-home message is.
Thanks for the question. Well, first, I didn't imply that not to worry if anyone have flu-like symptoms. If you have flu-like symptoms, anyone have flu-like symptoms, they need to contact the healthcare provider. We will ask questions about travel history, and then the management from there on will depend if the patient have a travel history or not. But anyone who feel with flu-like symptom or any medical condition, definitely they need to contact the healthcare provider for us to provide care for that person.
Yeah.
Is that making any clear?
Well, if there's somebody who's worried because they haven't got any medical insurance for some reason.
If they're not insured?
Yes.
Well, we care of anyone regardless of their insurance capacity. So of course they can contact their healthcare provider, or they can attend at the HSA as well. And there are different mechanisms. The government actually has different outputs for the management of infection diseases that will cover the management of patients that are not insured.
I know everybody should, but some people don't, and it's all,
and we will provide care to those people.
Stop them coming forward, you know.
No, I can reassure them that we will take care of them, and there is output from government to manage patients without insurance for communicable diseases.
Yeah, so I want to reiterate the no insurance, because that comes up quite often, and sometimes when people lose their jobs or otherwise or in transition, they lose their insurance coverage. I want to rest assured this government believes that no one should be turned away, and that has been that information has been transferred to the HSA. So if anyone has a question as to whether they can actually go to the hospital or not, if they don't have insurance, they need to call up the ministry, or even call the hospital themselves. Don't just stay away, but we have a policy. No one should be turned away.
Members of the media, if that's it.
I just want to say, rest assured, we have also, it's also mandated that masters of vessels coming in to the Cayman Islands must report to us anyone who they see or feel may be sick or may be coming from a country that may have this infection. So we have a health declaration form that must be submitted to us before the vessel arrives. and it gives us information on people who they suspect may be sick. So, you know, we've gone, we're doing what we can to ensure that we keep HSA informed. They've partnered with us. They're providing signs for the airport which will inform persons traveling, Caymanians, residents, visitors. You know, if you're feeling ill or something, let us know. And like Dr. Williams said, they'll be providing these forms where officers will be placing in passports, advising people if you're feeling sick or anything, reach out to this number, and they will deal with it.
Thank you so much, members of the panel and members of the